Next disease is acute bronchitis. We are going further. Acute bronchitis. I think you write down the slide number, maybe because we may start tomorrow from the slide number 27. Because before that, I remember one thing. There is in between, I have not written there because it's a more common in the children, more pediatric type of practice. But tonsillitis is one of the conditions which may not be in my slide, may not be in these PPTs. So write down another name in your notebook, tonsillitis, very, very common. Sometimes it is acute tonsillitis or sometimes it is a chronic tonsillitis. On the both the sides, you find the lymphoid glands. Everybody knows that tonsils are your doorkeeper. Tonsils, this lymphoid tissue is like doorkeepers. They prevent the infection, bacteria, viruses, fungi to go inside your respiratory tract. So when they get attacked, they naturally get inflamed because they are fighting with those, and so they get inflamed. And so that inflammation can occur frequently. And one day it is a big swelling, pain is there, high fever is there, throat pain is there. And when the patient comes to you, you must, especially children, ask them to say ah and see the torch. Okay, so there may be possibility of uveitis, number one, inflammation, padjip varte tumchi for the cough problem, or there may be tonsillitis, unilateral or bilateral. Now, why I am discussing this, there is a many times question, doctor, whether I should remove the tonsils of my son or my daughter, or what we can do, whether Ayurveda can do something or it must be removed, because I have heard that he or she is not growing her height or weight because tonsil infection is repeated infection is there. So we have heard that tonsillectomy done and then height will increase. This is something misunderstanding right now. There is no direct relation of the tonsil and height. There is no direct relation. But yes, it is indirectly related. How it is indirectly related? Not only tonsil, but any infection in your body, any infection from head to toe. If it is a repeated infection, what will happen? Your immunity definitely is low. Okay, and then there is no chance for the nourishment of the body tissue because your immunity is low, frequent infections are there, and that's why growth is hampered. But if it is in a severe condition that you feel that, especially about I'm talking about tonsillitis, that if tonsils are removed, the frequency of infections will be reduced, and then definitely the body height and weight of that child will increase. So for that matter, or some people have the doubt whether I can avoid or prevent that particular surgery. So write down my experienced treatment, but every time my suggestion is the same. You first avoid kapha vata prakopak ahar and vihar. Kapha vata prakopak ahar and vihar. Try to ask that child, don't give any excessive sweet things, excessive cold things, kulfi, ice creams, open food, no, never. Spicy food, fried food, telkat padartho, sarkha darod vada pav khatoy porelo. Then it will not be cured. So you must control his excessive irritating factors. Of course, the child is not smoking. I am taken into granted. If it is added, we must ask him to stop smoking if he is smoking. Okay. The next is positively he should gargle every day. Gargling is the most important for all respiratory problems. Take the warm water and the salt and spit it out. Minimum 5-10 times. This is a very safe method. Adravya rupa chikitsa. So gargling can be done on an empty stomach in the morning, in the afternoon, in the evening. More is the more better. Then at night, if possible, turmeric with warm milk, not cold milk. Turmeric with warm milk is also best for any respiratory problems. But better way, if milk is not possible, milk is not digested, milk is a problem, then only turmeric powder with water also you can take. Or a simple with jaggery, you can make a ball of the turmeric and the jaggery together, small circular balls, tablets, and then it can be taken. But turmeric is the best antiseptic, natural antiseptic according to Ayurveda. So this is one thing. Then Triphala Gulu, write down my dear friends. I am giving you the prescription of tonsillitis. Triphala Gulu for the child, 2 tablets. Kanchanar Gulu, 2 tablets. Triphala Gulu and Kanchanar Gulu, and then Sukshma Triphala. Sukshma Triphala. That means what I will say that Triphala Gulu and Kanchanar Gulu, 2 tablets of each if the child is of say 15 years or adult. If it is a low age, then reduce the dose. But I am taking the in general adult dose. And on average, the child is of 15 years old. Okay, child male or female. Then Triphala Gugulu, Kanchanar Gugulu, 2 tablets each. Take into after dinner and after lunch. Then another Sukshma Triphala and Gandhaka Rasayan. Sukshma Triphala and Gandhaka Rasayan from Ayurveda Rasashala, Pune. These again, Sukshma Triphala 2 tablets, Gandhaka Rasayan 1 tablet. 3 tablets in the morning, for example, during the breakfast 9 o'clock, and in the afternoon at 4 o'clock. So if you do these tablets for many days, then that can be helpful. In spite of Sukshma Triphala and Gandhaka Rasayan, or I am saying or, you can use Arogya Vardhini. So 2 tablets of Arogya Vardhini in the morning and also at 4 p.m. That will also help for the patients of tonsillitis. That can definitely reduce the, but that tablet should not be given for only 8 days. It should be continued minimum for 1 month and take the follow-up of 1 month while he is following the dietary advice and also he is following the gurgling and turmeric, etc., etc., and not eating spicy, not eating any cold food, freeze food, ice cream, etc. Okay. Let us start with the acute bronchitis. So there is inflammation of bronchi, complaining of fever, cough with expectoration because the infection is going now down. Is an LRTI, lower respiratory tract infection. So many or kaphaja kas is there, kaphaja kas, and retrosternal chest pain, coughing, coughing, coughing. So muscles and especially muscles, they start getting irritated, inflamed, and they start little bit paining. On examination, few rhonchi and bilateral crepitations. Sometimes there may be rhals also, but basically still main bronchi is affected, rhonchi will be there, and at the base part there will be crepitations. So these words you must write down because in respiratory system, auscultation with stethoscope is a mandatory. Whether you practice Ayurveda, allopathic, homeopathic, naturopathic, I feel if the doctor is not using stethoscope for examining respiratory system, he is making an offense. He is making an offense. Darshana, Sparshana, and Prashna. Darshana is inspection. We are not opening. Ideally, when you go to the consultant, they ask to take out your shirts, and whole chest part is open for the male patients I am talking about. And that examination is done by consultant. But at least you can have the examination with stethoscope, Sparshana Pariksha. Okay, and you will find these abnormal breath sounds. Now here I must give you the little bit hint about physiology. What are the normal breath sounds? This is the question for examination. Normal breath sounds. Write down. Only 2. Vesicular and bronchial. There are only 2 physiological lung sounds, respiratory sounds. Vesicular and bronchial. Is it clear? Vesicular means is like a wind or is like hustling of the leaves. पानांची सळसळ. मराठीमध्ये पानं जशी एकमेकाला वाऱ्याने वाजतात ना, पानांचा आवाज येतो की नाही, लिव्स, ट्री लिव्स, तशा स्वरूपाचा इन सिमिलर वे हसलिंग of the leaves, that gives the sound is called vesicular on both sides of the lungs. Okay, but if you put your stethoscope at the mid part here, can you see me? I have a little bit up here, central part, this one, this one, this one, this one only, trachea. So when you put the stethoscope over there, sound is more different because srotasa is a big macro srotasa, sthula srotasa. So bronchial sound is heard only over here. Bronchial sound. All over is a vesicular sound. These are normal physiological sounds. And what are the abnormal sounds? Mainly there are 2 types of sounds. Vataja dhvani, write down. Vataja dhvani and kafaja dhvani. Vataj dhvani, Kafaj dhvani. Two types of the abnormal sounds. Vataj is a dry sounds. Ronkai. Rhonchi. Ronkai. Okay? Ronkai. And there, Kafaja dhvani, Ras. R-A alias. R-A alias. Ronkai and Ras. Vataja dhvani, Kafaja dhvani. When fluid is more, secretions is more, Kafaja dhvani. When dry inflammation is there, that is Ronkai. Is it clear? One of the type of Ronkai is whistling sound. Another variety, whistling. Bronchial asthma. Bronchial asthma, whistling sound. Chitti sarkha awaz. It's a type of dry sound. And then in the ras, there may be crepitations. Here you can see crepitation. That is a type of ras. Okay. So what you do in the bronchitis? First you do the bed rest, number one, because infection is there. Fever is there. Is there. Whenever fever, bacterial toxin, according to Ayurveda, is called as What is chikitsa? 3 Write down. Tablet 3 Suntha mire pimpri. Dry ginger, black pepper, and piper longum. Maricha. Suntha, maricha, pippali. Okay. So always, whenever acute things are there, fever is there, is there, body should take the rest. Stop smoking, steam inhalation. Slide number 28. Please, my dear friends, last 1 minute has remained. What is the treatment? Antibiotic, tablet Novamox, amoxicillin, 500 milligram QID. Okay. Then Benadryl expectorant, tablet bromhexine, which is mucolytic, stickiness is removed, and Combiflam. Now in Corona, don't take Combiflam. In Corona, no Combiflam. Ibuprofen, no. Only paracetamol you can give to the suspected Corona. Any cold, cough, fever nowadays, only give paracetamol. Please don't give Combiflam because it is proved that this ibuprofen can damage to the patient in Corona infection. Okay. If the breathlessness is there, tablet Derifylin, 1 TDS, 1 morning, afternoon, evening. TDS means 3 times in a day. So Novamox, expectorant, bromhexine, Combiflam, and Derifylin. I think, my dear friends, I should stop here because the time is up. 28, write down, slide number 28. We will continue tomorrow. Thank you very much for your patience hearing, and don't forget to subscribe my YouTube channel. Thank you. Myself is Professor Dr. Deshpande, and today is 20th April 2020, and in this time at 2 to 40 p.m. we are trying to learn respiratory problems in general medical practice. As you know very well, since last I can say the 2 weeks or more, Professor Deshpande is taking these online lectures for the benefit of the students, teachers, and the practitioners, because this is unfortunate disaster in the world, Corona pandemic. My dear friends, respiratory problems in GP presented by myself, that is Professor Deshpande. I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. This is my WhatsApp number 922681060, and you can also contact me on this mail ID, professordeshpande@gmail.com. You can have the benefit from me regarding your personal or online health problem advice, personal or online lifestyle counseling based on Ayurvedic Prakriti and also the palmistry. Yes, I do the palmistry as well. Personal and online classes of medicine and any subject of Ayurveda. But my dear friends, these are all the paid services. Please subscribe my YouTube channel. I think you may be remembering that we were here, acute bronchitis problem. But whenever we talk about respiratory system, you must have Ayurvedic some concepts in your mind, that is regarding the prana vada srotas. And as you know, there are 13 important channels in the body, 13 important srotasas. And the common causes for getting the deformity or pathology in these srotasas, you can have this shloka, verse, aharascha, viharascha, yaha syat, dosha gunahi samaha, dhatubhir gunaschapi, srotasamsa pradushakaha. While practicing Ayurvedic or modern or homeopathic practice. If you do the main basics from Ayurveda, that will be definitely helpful whatsoever the stream that you are practicing. So it's a Samanya Vishesh Siddhanta because Pranava Sutas is mainly connected with Prana and Udana. Anuloma Gati of Prana and there is a Pratiloma Gati of Udana. If these two nerve impulse conduction gets disturbed or irregular, then that can cause the problem of your pranava sutas or respiratory system. And then what type of the pathology we expect? As you know, samanya lakshana of suto dushti lakshana, that is atipravrutti sangova, siranam granthiyopi va, vimargadamanam chapi, srutosam sapradushakaha. But I am going to conduct the pure Ayurvedic understanding classes of medicine. So I have the just passing remarks when I am teaching you the modern medicine. We are talking about acute bronchitis, and you say this is the inflammation, and inflammation because of the either viral or bacterial, or many times it can be allergic. But if you feel that there is a high fever is there, sputum is yellow or green, then definitely you can give the antibiotic like amoxicillin and then expectorant, then this mucolytic, because there is a sticky mucus that is very difficult for the elderly people to take out that particular sticky cough or sticky sputum. So mucolytic bromhexine tablet is available, syrup is also available. Then combiflam, it's analgesic, anti-inflammatory, and antipyretic. But remember, I have already warned you, in this corona suspected cases, when there is a cold, cough, fever, sore throat, you should not use the combiflam. You must use only paracetamol, because it is proved that some ibuprofen type of the drug can make the condition of the corona patient more worse. So be cautious. Then if there is a dyspnea, breathlessness, then this is a tablet. Theophylline is a generic name and Derifylline is a brand name. So injections are also available and tablets are also available. It is very interesting to note, when your asthmatic puff were not in their market or in their medical field, when I was practicing, I used to give this injection Derifylline IV to each and every asthmatic patient in the exacerbation condition. So in our time, this Derifylline injectable IV was very, very popular. And nowadays, still it is used as a tablet or sometimes as an injection as well. Then, when we are talking about bronchi or bronchitis, you must understand the concept of bronchi, bronchial tree, and the lungs. So this is the laryngeal part. This is the main trachea. Here you can see the name. Then first branch is called as a primary bronchi, then the secondary, then the tertiary. Lastly, bronchioles are there. This is the cardiac notch on this left side. Okay, and then this is the final structural and functional unit of respiration, that is alveoli, where the gaseous exchange takes place of O2 and CO2. Okay, but we are talking about bronchitis, so problem is restricted over here, but still it is LRTI, lower respiratory tract infection. If it is above the trachea, that can be called as a, for example, rhinitis, then your pharyngitis, tonsillitis, all these are URTI. Try to understand the words URTI and LRTI. There are many patients who have this type of bronchitis attacks, exacerbation, or we can call it as a relapse, vegavastha, again and again, because they are the chronic sufferer. There is a permanent inflammation in their bronchial tree or intermittent exacerbation of that inflammation. So they always complaining of cough with expectoration. And if you take the, it's not continuous, I am saying at least for 2 years mean history. Try to understand the history of cough will be minimum of 2 years. He will say, doctor, I am suffering from many months. Last 2 years I am suffering. Then that is the case of chronic bronchitis. What on examination? Widespread rhonchi. As I have already explained you, Vataja Dhvani and Kafaja Dhvani. So these are the Vataja Dhvani, as well as there is crepitations So at the base of the lungs, there is more accumulation of secretions at, at the bottom because of the gravity. Are you getting the difference? Upper part, there will be bronchi because of the spasm or inflammation. But at the lower part of the lungs, there will be accumulation of the fluid, and that's why there may be crepitations at the basal part of the lungs, at the bottom. Okay. Then prolonged expirations. Expiration will be prolonged because again there is a spasm of that bronchial tree. Fever, but here I have mentioned only in exacerbation attack or attack, Vegavastha. That means whenever the condition is little bit worse, infection is superadded infection, bacterial infection, basically Stroto Vaigunya is there. Try to understand this Ayurvedic word. In the chronic bronchitis, in Linavastha, write down this word, Linavastha, those are there, but they not get Prakupita. They are silent and they are waiting for the opportunity. Waiting for the opportunity. When the person eats too much ice cream, then cold free stuff, cold drinks, and the air conditioning, he has a bronchitis. But after eating all these things, immediately kapha prakopa will be there and vata prakopa will be there because of the shita guna. So I think two things are very clear. One is a chronicity, that is Sroto Vaigunya, and after kapha prakopa ahara, Sroto dushti will take place, and here, can you see exacerbation? So fever will come. That is because of the super added bacterial infection. Super added bacterial infection. The word is very important. Super added bacterial infection. Then, in this case, definitely you can advise the X-ray chest. Here you can add not only this thing, but chest. And what is that? PA view. That is most important. Okay. PA view. VREW. Okay. So this is most important part. Then what you will see in the X-ray? Prominent bronchovascular marking. Report will be prominent bronchovascular marking, and this, if X-ray report shows, then definitely this is the case of chronic bronchitis. Okay. What is the treatment? There are two types of treatments. One is in the exacerbation or the remission or Vegavastha, and another is for the Avegavastha. When the attack is not there, what the patient should do? But basically they will come to you whenever there is an attack. So you have to treat them, this patient. In acute exacerbation, steam inhalation, Svedana, according to Ayurveda, to make the Stroto Mukha Prakshep. That means you have to enlarge the Stroto. Whatever the obstructed pathway is there, that's because of the Svedana, expansion will take place. Bronchodilation will take place. Then to remove the kapha dinachititsa, stickiness, Tyanatva, bromhexin tablet, 8 mg TDS 3 times in a day. If dyspnea and breathlessness is severe, then of course tablet asthalin or salbutamol, 4 mg tablet, 1 tablet in the morning and 1 tablet in the evening. Okay. So here you can see this is a generic name, this is a brand name. Then next is this, or remember this is not both together, but here I can add, or you can use the tablet Bricanil 2.5 mg 3 times in a day. That is terbutaline. Terbutaline. Here I must mention that you add the word, these both the drugs are bronchodilator. Write down. Pharmacologically, bronchodilator. That's why they relieve the immediate breathlessness or the dyspnea of the patient. So every time, my dear friends, you can make the screenshot or take the photograph of each slide. As I'm saying you, most of the respiratory tract infections are bacterial in origin. There are a lot of antibiotics available in the market. So some of these you must remember for yourself. Of course, when I say antibiotics, this is the exception. This is not the, try to understand. This is not the antibiotic. Write down. This is not antibiotic. This is steroid, Visolon or the prednisolone. This is not antibiotic. Although the title is that, last line is not antibiotic. Okay, this is very clear. Tablet mox or amoxicillin, oldest antibiotic. It's a derivative of penicillin, but penicillin gets a serious reaction. Remember my words. Injection penicillin especially should be given after sensitivity test. Injection penicillin, if by chance somebody wants to use injection penicillin, still some doctors are using and very much fond of, they like this penicillin because it's a very good antibiotic. So they use the procaine penicillin most of the times. But this penicillin should be tested before giving to the patient. That is called as AST, after sensitivity test. According to Ayurveda, you can say there may be asatmia, and it can cause anaphylactic shock. Anaphylactic shock. The patient can die on spot, on the bed itself. There are only 3 things in your practice you must remember which injections can give anaphylactic shock where the patient die immediately when you give the injection. Very serious. So these 3 injections should be given after test dose. Better it should be given in the hospital for testing purpose. Then you can practice in the GP. First, injection penicillin. Second, injection neurobion. Write down, injection neurobion. It's a combination of B1, B6, B12. B1, B6, B12. Injection neurobion or polybion, B complex. In that, B1 thymine can cause anaphylactic reaction. B1 or thymine. And third, injection of iron given for the anemic patient. The names are injection imperon, and jectopher. Injection imperon, injection jectopher. So I had given 3 names to you where you should be very cautious. Then this is the cephalosporins, cephalexin, 500 milligram 4 times in a day. QID means 4 times in a day. Then cefuroxime, the brand name is Ceftum, 250 milligram BD. Can you see, this is called as the next generation cephalosporin. You write down this word of pharmacology, next generation antibiotics. What is the benefit? Here, actually, this is the quantity is big. Can you see? 500 milligram. And we have to give for 4 times. But here, only 250 milligram and only 2 times. So, can you have the judgment that power has been increased? The medicine power has been increased. After cephalexin, latest is cefuroxime. It's called the development in the research. Ayurveda has the same thing. Ayurveda previously had only vanaspatija, herbal origin tablets. Then came the rasaushadhi. So rasaushadhi is acting more fast, herbo mineral. So this is the same over here. Then again further you can see levofloxacin, 500 milligram OD. Also 500 milligram, but only once. Can you see? Only once. So why this has been made? 2 or 3 possibilities are there. These having show a little resistance. Why the new antibiotics? Why the new antibiotics? Because it is observed that many patients don't respond to MOX. Many patients don't respond to cephalexin. Many patients don't do response to the Ceftum. Then they prescribe LC. So this is 500 milligram, but only OD, once in a day. Only 1 tablet, finish, for 3 days or 5 days. Then azithromycin, most popular antibiotic in last 5 years, 3 years. Everybody knows. Layman also knows. Tablet Azi, 500 milligram once in only 1 time. But this was olden tablet, Bactrim DS. From my olden days, I used to use this type, Bactrim DS, double strength. Cephalic, it contains a sulfur. Okay, so 1 BD, morning and evening. This is reserved now only for the HIV patients having this cough problem. Very interesting. Bacterium DS is given for more days, 10 to 15 days, for the cough in HIV patients. Then tablet Visolon or the prednisolone 10 milligram TDS if bronchospasm persists. This is not antibiotic. Write down. This is steroid. And I have given already the explanation about steroid. This is a Dudhari Shastra, double sword blade. So it has the benefits as well as it has a lot of side effects. It should not be given or very carefully given to the patients of hypertension, to the patients of diabetes mellitus, to the patients of peptic ulcer, and to the patients of osteoporosis, because all these problems will increase. And as you know very well, endocrinological problem of long-term use of the steroid, that is Cushing syndrome. Most important for these things, I will write down. This drug should be given in a tapering dose. Tapering dose. Write down. This is very important. Tapering dose, this concept is very important for steroid. It should not be stopped abruptly. One day, patient has taken 3 times in a day Visolon, his cough stops, and you stop the medicine. This is very wrong. This is very wrong. So first 2 days, 1 TDS. Next 2 days, 1 BD. Next 2 days, 1 OD, and then stop. So this is called as a step-by-step lowering of the dose, which is called the tapering dose. Next, very important suggestion for using the antibiotics. Your patients are not serious about the antibiotics. They take it very casually. And even some doctors, they don't bother. But it is your duty, it is our duty to convince to the patient that antibiotics is not a routine medicine. You cannot take as if your own. So antibiotics should be given minimum for 3 to 5 days continuously. Even, I'm very sorry to say, but some medical practitioners, they pressurized by the patients. They come after 1 day, they say, doctor, no use of your medicine. This capsule that you give us has nothing effect. My cough is continuous. And then doctor gets stressed. He immediately asks, no, now take this tablet on the second day, this antibiotic, new antibiotic, another antibiotic on the second day. Very, very wrong. Doctors should have the patience. They must say that you will get the effect only 6 tablets are in your stomach. After you engulf 6 tablets, then the course is finished or it will start acting. This is your statement. You should not ask the patient to change the antibiotic, to stop the antibiotic haphazardly. Because if it irregular giving and taking antibiotics makes the resistance to that particular antibiotic. What is meant by resistance to the antibiotic? For example, I have the patient XYZ, he has a chronic bronchitis, I am prescribing all the time cephalexin. After 6 months, because of his wrong style of taking medicines, he is not getting the result. And he said, Doctor, ते तुम्ही पूर्वी द्यायचं ते उपयोग व्हायचा, आता काय तुमच्या गोळ्यांचा उपयोग होत नाही. That is called as a resistance. Patient is saying that I am not getting the benefit of your medicine, that particular antibiotic. That is, resistance is developed because of the wrong taking and giving the antibiotic. So you should be very careful. So sometimes it happens in the chronic or in complicated cases that you don't get the result with the chronic bronchitis or bronchiectasis patient. Then what next step you must follow? Culture and sensitivity test. Write down. Sputum, we know that sputum for AFB, everybody knows, acid fast bacilli. 3-day examination of sputum for tubercular bacilli, everybody knows. I'm not talking about tuberculosis. I'm talking about bronchiectasis patient, lot of cough, bronchitis patient, pneumonia patient. If your particular antibiotic is not acting, then what we can do? We can do the test in the medical laboratory, pathological laboratory, culture and sensitivity, C and S. Write down. So you must take the phlegm or the cough coming from the throat, coming from the bronchi in the sterile bottle and ask for culture sensitivity. Always you get the report after 48 hours. You have to wait for that period. It's not instant. Okay. Next, chronic bronchitis treatment after acute attack. For example, fever has gone, cough has been reduced. Medicines to prevent the recurrence. That every after 1 month he gets the attack. What you can suggest from the modern point of view? I'm not much talking about Ayurveda right now. So you can give him tablet Doxy. Tablet Doxy 1. The name of the tablet is Doxy 1. 100 milligram tablet, 1 OD. The generic name is doxycycline. This should be given from 1st to 5th day of each month. If the person is getting every month attack of the bronchitis, chronic bronchitis, exacerbation, Vegavastha, relapse, then this can prevent, doxycycline tablet can prevent that super added bacterial infection. Then by chance, or if he has taken this medicine, but he starts again the cough, and that cough is purulent, yellow and greenish. Remember these colors, always 3 colors for sputum: white, yellow and green. White is Nirama Avastha, write down, white sputum, Nirama Avastha according to Ayurveda. But yellow and green sputum is the Sama Avastha according to Ayurveda. So naturally your Ayurvedic medicines also be little bit more stronger when you treat this yellow and green cough in bronchitis. So he should take amoxicillin 500 milligram when the cough becomes purulent, yellow and greenish. Immediately start 1 TDS for 3 or 5 days. But most important advice for the chronic bronchitis is this one: stop smoking completely. Stop smoking absolute. No alcohol, no smoking, no tobacco, no pan parag, nothing. Because Kroto Vaigunya will be created. Vata Prakopa will be there. Rukshata will increase. We must try to find out which guna of the dosha is vitiated. Vata Prakopa is a general term, but what are the Vata properties? Tatra Ruksha Laghu Shita Khara Sukshma Chalonilaha. Tatra Ruksha Laghu Shita Khara Sukshma Chalonilaha. So Rukshata is increased, Laghuta is increased, Shitata is increased, Chalata is increased. Because what is the best management principle? Sanshepataha Kriyayogo Nidana Parivarjanam. Write down. Sanshepataha Kriyayogo Nidana Parivarjanam. We must find out what is the culprit. Where is the mistake? Patient is not taking nutritious diet, dry diet is taking, no water content, जाता येतात चरणं म्हणतो आपण त्याला मराठीमध्ये. Very casual diet, no nutritious diet, that is rukshata. Then he is doing lot of fast